Hey, well, excited to be joined today with Dr. Justin Sharp. And honestly, Dr. Sharp and I literally just met. So we had this whole moment set up through other powers that be, friends of ours that are working for us and making this happen. But excited to be sitting down with you, Justin. It's only our second interview with somebody that's in the medical profession. And the first interview I did, for me, it was super enlightening. Like I learned a ton. And so I'm expecting we're gonna have a good time connecting, hearing about your journey. And again, our hope and our thought here is kind of peeking back behind the curtain of the medical profession, hearing some insights from somebody that actually knows what they're talking about instead of somebody like me who just has a bunch of opinions and probably is not going to be very helpful to individuals. So good to have you with us. It looks like you're coming to us from the foggy Bay Area. Is that true or no?
That is not true. I am in sunny and pretty cloudless in the sky, Redding, California.
Okay, so you're up here in Redding with us, but there's some kind of an affinity to SF.
There must be. It just naturally came into my background. So I've never lived there. It's a beautiful area. I've been across the bridge a few times.
Okay.
But it's iconic. It makes people feel like they can contextualize at least where I'm at, northern-ish California.
That's good. Well, yeah, we're so happy you're joining us. So talk a little bit about your journey. What brought you into the healthcare world? Talk about what you're doing in the healthcare world first, and then as you answer that, just talk about your path into medicine.
Yeah, I work in a pretty specialized niche of medicine. I'm a neonatologist, and I basically trained to be a pediatrician and then went on to get specialty training to take care of babies in the neonatal intensive care unit. Most people have possibly never set foot in there unless they have had a personal experience or a family member or a friend that's been in the NICU. And so I just take care of babies immediately after birth if they're not able to stay in the room with mom and dad. So it's largely preterm babies that are born early, but additionally term babies that have varying degrees of problems that would require additional support outside of mom and dad's hospital room. So I've been doing that for about 10 years or so. And my pathway toward medicine started when I was in high school. I actually served as a nurse's assistant in my small town hospital in Pender, Nebraska, a town of about 1,200 people. And I was drawn to the relational dynamic that existed between the physician and the patient. There was just a level of vulnerability that was created, maybe even without any past relationship, where a patient was willing to divulge intimate details of their life and be extremely vulnerable. And as one who values connection and relationship with people, it really drew me to want to be in the realm of medicine and be a part of that. And so I initially had an aspiration to go down the family practice route, largely because that's all I had been exposed to growing up. But then as I went into medical school and went on to become a pediatrician and do what I'm doing now, I found a niche that fit me a little bit more uniquely. I don't have the luxury of extended time with families because once they are discharged from the NICU, I don't see them anymore. But the vulnerability that's created because of the circumstances of being in the NICU, I really am drawn to that, and I enjoy being a source of hope and comfort to a pretty traumatic, scary situation for a lot of families.
Wow, that is so powerful. Yeah, I can't. I mean, I'm just thinking that what a huge spot in somebody's life for however long the moment lasts. Like you're in a place that is very critical, very primary. Yeah, and how tender the parents must be, and then obviously that little life, like a little newborn that's like trying to come into being sustainable and strong and healthy. And that's amazing. That's so inspiring for me to hear your motivation and that you discovered that motivation at a young age. What a gift. That sounds like a real gift from God.
Yeah, it really was a gift. It was the struggle for me. I've always been comfortable with the relationships and always found great value, not only with the families that I interact with, but the NICU has such a unique group of people that work together, that come alongside each other to really minister to these families and take care of these babies. The medicine has been the chore for me.
Yeah.
As I was going through training, I mean, I wanted to quit so many times because it was so difficult, and I didn't have as much of a natural affinity for the actual medicine aspect of things. And my prayer throughout most of my process was, Lord, can you just download in my mind some way, give me the ability to just know all this information and memorize it, and then I can just focus on the relational aspect. And he's like, no, you need to learn the craft as well.
Yeah.
And so he used that process mightily, but still I think in part to create a dependence upon him, because like I said, the relational piece was so natural, the medicine wasn't. And so me needing to really depend upon him to help me get through some difficult times in that process.
Yeah, but the knowledge and the insight and the craft, as you put it, or the science, like that's pretty vital stuff, right? Like you're not going to be successful in medicine without that side of the equation, I'm assuming.
No, you're not going to be very successful, and you're not going to have families too happy with you. You can be the nicest person in the world, but if you're incompetent in your practice of medicine, you're not going to last very long. So it's good to be excellent in both of those, and that's my aim.
That's inspiring. Back to the care side of things, what are your, this isn't to like make any kind of judgment call, but like how many of your colleagues do you feel like have that similar undergirding of like, yeah, I'm here because I care about people. Like maybe they were drawn into the field with a similar sort of color or theme behind their choice to go into medicine.
Yeah.
A pretty large percentage, or?
No, it's pretty small percentage of people that ended up getting down. I mean, a lot of people don't even know. I was at a meeting at the hospital a couple of weeks ago, and no one had met me, since I don't interact much with any adult physician or specialist at all. And so I always open my introduction by saying who I am and saying that we do actually have a NICU in our hospital, because most of them would have never set foot in that environment, because it is such a unique environment that we take care of babies. But I would say in my field in particular, you might hear stories of, okay, physicians are, some are maybe motivated by power or influence or finances or whatever it might be. But as I look back at my colleagues, as I went through the initial training process, I know that everyone gets brought into it. I would say overwhelmingly so, because of a desire to have an impact in people's lives and to have a positive influence. And I would say the area that I work in even more so, because the realm of taking care of not only kids, but taking care of babies, I think it is just such a unique call for those people. And I see it every day, where I have male and female colleagues where this maternalistic kind of paternal innate bond, innate desires, innate expression comes out in them as they take care of these babies, because sometimes the babies come from really difficult circumstances with the moms, whether it's abusive type situations or whether it could be substance abuse dynamics. We get a fair number, especially here in this community, of babies that are born into an addictive type of environment because of choices that mom made. And so I see people that I work with every day that they would say as well that they're called to this, and whether that was early in life or later in life, it's where they feel like they're called to be.
Yeah, I think that's such an important piece of information. Because I think for me as a general citizen, somebody who receives medicine, healthcare, like goes to doctors, I don't always experience that exchange of care and feel, because they have to get their work done. They're so busy, and this isn't me judging doctors at all. It's like their caseload, and it's probably so stressful. And so for us to know at the outset, like a lot of people in medicine, they really feel a sense of calling there because they want to help people. Not because they're after power, not because they're getting paid so much money. And that's just a really refreshing piece of information, And to hear you say like, yeah, I'm in it up to my eyeballs, and and I'm surrounded by people that like, we really just care. We want to see people doing well. Yeah, that's encouraging. But yeah, your unique space of working with babies, I can only imagine that's got to be such a tender environment. Um, anything you want to share from your journey in that space of how you've been able to help families? And obviously, you don't need to share anything like intimate details of families being in crisis, but maybe
Yeah.
some of the things that you've seen that you're like, wow, that was amazing to be a part of, you know?
Yeah. No one ever signs up during their prenatal classes for who their neonatologist is going to be. You're picking out maybe who's going to take care of your baby, whether it's a pediatrician or a family practice doc, but
Yeah.
nobody wants to see me. But thankfully there are individuals like me and my team that are around to step in especially when it's unanticipated, whether it's a mom that unexpectedly went into preterm labor for no other reason at all, or a term baby that comes out and is having difficulty for whatever reason.
Yeah.
And so I've seen, I was thinking of a situation recently that really brings together the power of family, the power of even kind of family heritage, of all that medicine has to offer, all that prayer can bring into a situation. And I share this because of it being very public here in the community with how this family has released a lot of this information. There was a mom that was in a significant motor vehicle accident roughly a year ago. She was early. She was probably 7 weeks along in her pregnancy. I happened to be the physician that was on call, and I came into the operating room because the mom was doing so poorly. They weren't sure if she was going to survive, that they were potentially going to take the baby out of mom so that the baby could survive in the event that mom would pass. The mom was she survived. The baby stayed inside for a couple days, and then mom's status changed where a physician had to take the baby out early.
Sure.
I was there to help take care of that baby, which is, again, that's something that we routinely do, is we take care of preterm babies. And then that baby continued in our NICU for a couple months. Well, the story with mom is that the physicians were so concerned about her degree of brain injury that they had talked with the mother's mother, the grandma of the baby, about redirecting care or taking the mom off of life support because of how grave their prognosis was. But the grandma was adamant that we were going to keep fighting and that she would want us to keep fighting. And so she mobilized so many different prayer teams, and there were people that prayed for this mom at the bedside, myself, some colleagues, and I.
Wow.
And you fast forward again a year ago, and I saw a TikTok video of the mom who was in the accident that had the significant brain injury. She is now communicating verbally in the same way that she was before the accident. She has some physical limitations where she's not able to ambulate or walk independently, but it was just such a full circle story, and it was not without heartache and difficulty, and it's been a process, and I'm sure it will continue to be a process, but it was a beautiful blend of people taking the best care of that mom possible in addition to the baby possible, and then bringing in a determined grandma and the power of prayer, and we're able to see something that wouldn't have made sense medically as someone would have looked at the initial presentation. And so just to be a part of something that brings in the best of all of those worlds and expresses it in a unique way, now with the luxury of 12 months down the road, is extremely powerful. And we get invited into those types of dynamics more than maybe the outside world would think.
Yeah, that's amazing. Does that story kind of typify some of the most encouraging things that you experience in your work? Like talk about the things that, like, in your line of work, these are the things that really make me happy. These are the things that I just like, maybe pinch yourself like, wow, this is incredible what I get to be a part of.
Yeah, I think it's the relationship with my colleagues, the nursing staff, and you have physical therapists, speech therapy, dietitians, pharmacy. We have a large team that helps take care of babies. And so I get a lot of great personal satisfaction of working with other individuals, connecting with them, bringing about the best of what they have to offer, creating an environment where people feel safe to bring up ideas and to challenge each other. So I like that on a personal level. The medicine, as I mentioned earlier, the medicine aspect, it's neat to see babies progress and get better. I wouldn't say I get a huge amount of satisfaction, ironically enough. That might sound unusual for a physician to say that. But what I get probably the most satisfaction is being able to come alongside a family. And again, and it could be a spectrum of disease severity. It might be a baby that I look at and say, well, this baby's really not that sick, but in the eyes of this family, this baby is extremely critically ill, and they're concerned about whether their child is going to survive. And I'm able to come in through the tool of medicine, but also the tool of experience and what the Lord's put on me to be a deliverer of peace and bring peace and to bring comfort to that family and to bring language to a very foreign language that is medicine, especially in the NICU. And so I get a great deal of satisfaction in doing that. And then I've had encounters along the way as you get to know families. Because the babies, they don't talk a whole lot back to me. So that's a little bit tougher. Maybe that's good and bad at different times. But the ability to step in and pray with a family that's going through the difficult time, or to be able to see something in them that's maybe a part of their social fabric that's been toxic or destructive, and try and minister in that environment. Because again, I get access to these people's hearts by virtue of my position. And so it's not sneaky. I'm not being manipulative or deceptive, but by nature of my position, I'm able to gain access into their hearts in a way that I wouldn't be able to do if I just saw them in the street, or even if I saw them at church or some other religious environment where they were even seeking prayer or comfort. It's just a unique expression, being a physician, to be able to minister to people.
Yeah, it sounds amazing. What an opportunity. Talk about some of the other side of the coin, the things that are bigger challenges that you face, things that are potentially discouraging, things that, like, just whether it's big stuff with the whole medical care industry, or it's just like stuff that's right in front of you because you're a doctor, and it's like, this is hard. Like, these are really challenging things that I have to navigate because I'm a doctor,
Yeah. And I have a bit of a unique perspective. In a previous position that I was in before moving to Reading, I served as a medical director of essentially a physician wellness program. And so I was able to even get a sneak behind the curtain in the profession that I operate in that maybe I don't normally see.
Yeah.
And, some of the hoops that my colleagues have to jump through to be able to deliver care, again, that drew them into the practice of medicine in the first place. And yet now they're faced with all of these demands, whether it's administration in their particular area that they're working in, whether it's insurance dynamics, whether it's reimbursement rates and things like that to keep their practice going.
Wow.
It can be a difficult environment for physicians in particular to practice. And what can be difficult about it is that we are trained in a way to be achievers and perseverers. And so we're at the position we are by virtue of the characteristics that we have and the result of all that we went through. You're not a physician without having gone through adversity and difficulty.
Yep.
And unfortunately, as physicians then encounter more and more of that in their work environments, there's a tendency to have a bit of a Lone Ranger, I can do it all mentality. It's similar to people in ministry, I'm sure, where you're less likely to be open and vulnerable about what you're struggling with, and therefore you never actually receive help or assistance, whether that's with counseling or whatever it might be. And so we unfortunately have a swath of providers that are there to minister to people, but ultimately they need to be ministered to themselves. So that's a difficulty. It's kind of the tendencies and the characteristics of physicians that got them to that point, and then you put them in an environment where they just get worked to the bone.
Yeah.
And they don't feel necessarily like they can do what they were called to do. So it leads to huge levels of burnout and difficulty. So I see that with colleagues, although it can be really difficult to see that because we're very good at covering those things up.
Is there anything that you see that's addressing that one concern, like just the ability for doctors, medical professionals to be vulnerable, to have fellowship, community? Is there anything going on that you've heard of or are participating in that?
Yeah, I think that, I mean, there's an individual at Stanford here in California who's been a strong voice he's a physician, and he's been very wise with how he's approached this particular problem, because he has approached it not only from, I mean, everybody would agree that we want to, it's morally right to be able to take care of the people that are taking care of us. But unfortunately, that doesn't always resonate with those people that are trying to meet the bottom line, maybe of an administration or a hospital system. We can't just give physicians vacations to Hawaii to go relax, which would be nice, but that they're probably not going to do that. And so he's approached it from a point of, okay, these are some of the administrative costs that we know are associated with physicians that are burnout or are wrestling with burnout. And he's done studies to look at physicians that are on the burnout continuum, they're less productive. And so they're ultimately generating less money for the health system. They're more likely to have disgruntled patients because the interactions with them are not satisfying on behalf of the person receiving the care. And then he's shown more and more that patient outcomes are worse after going to physicians that are wrestling more with burnout, which really all makes sense, because what we deliver is not just a pill or a therapy. There's a relational exchange that can occur in those rooms, and if the provider is not walking in health and wholeness, it's oftentimes going to trickle down to the patient, and then ultimately represent the institution that they work for and cost more in the end. And so there are different programs that are really trying to make workflow more efficient for providers, to try and give them more time to interact with patients. And then I believe there's more and more vulnerability being expressed through providers themselves, which I think is one of the most powerful tools that we have, to be able to say, hey, I'm wrestling with this. This is what I've done. This has helped. And then that might increase the chance that someone else feels safe to pursue those same resources.
And on the other front, some of that stuff that you saw as you were in more of a director role, do you see like needed changes coming to address some of those very stressful dynamics? Like you mentioned insurance industries, you mentioned like you got to keep the bottom line. You talked about, I forget the third thing you mentioned. I think it was, I think you said even the ability to keep practicing. So there may be a financial dynamic where it's like the reimbursement rates are such that people have to close their doors instead of continue practicing. Are you aware of any reform? I know those are all very large issues.
Yeah. Unfortunately, I think some of it is more at the local level of where that physician is employed. I know there are some health systems that have really embraced this. Yep. And said, we're going to champion in whatever way is reasonable right now to be able to implement some of these changes to make things better. Yep. But then I hear other stories of other individuals that work for a different organization that they aren't receiving that same level of love. So sure. I think it's a bit geographic and institutional dependent.
Yeah. And I don't know, my general sense, and I'm not a professional, but my general sense is that if you're a medical professional, I guess there's more and more stimulus coming back towards me, a general person, that like it's not only is it hard to be a doctor because it's a hard job, but it's hard to be a doctor because it may not be working financially. And so there's like systems in our nation or in our national healthcare system that makes it harder and harder to be a doctor. I guess it depends on the post you man and the role you're in within healthcare,
Yeah.
the levels of truth of that statement I just made, right? Um, but I've heard, yeah, like the family practitioners are kind of, or the general practitioners are kind of going away because it's hard for them to like do business. And I just kind of scratch my head like, okay, I don't know why that would be a true statement, but I hear it enough that I'm like, gosh, that feels concerning. I'm
Yeah.
not concerned enough that I need to go figure out the answer to that problem. But I am aware as a leader and a thinker, like, I wonder what's being done, and I wonder how doctors are really doing. And I would love to see them thriving. And talking to someone like you feels very enlightening. It's very encouraging. Your way, your perspective, the way you're going about your business, it gives me a lot of hope for others that are in healthcare. It sounds like
Yeah.
a lot of possibilities and a lot of potential and a lot of people doing a lot of good. So good job. Thank you.
You're welcome.
But some of those bigger issues, it's like, yeah, it sounds like that's maybe locale to locale and role to role. So
Yeah, I think so. And even specialty to specialty. There are
yeah,
some specialties that again, society has deemed, and kind of the payer system has deemed to be of greater value. And so
yeah,
then they are reimbursed more handsomely. And those oftentimes are not the primary care specialties that are taking care of
yeah,
people at the front lines, or even taking care of children. Pediatricians are some of the most, I'm not speaking of me, general pediatricians. I'm very blessed in my field that I'm in, because it is in the hospital. So it's got a little different model and even payment expression than it would for a general pediatrician taking care of children. It can be difficult because they're some of the lowest reimbursed providers in our system,
yeah,
compared to someone who does maybe a surgical subspecialty.
yeah,
And again, it's a degree of what the powers that be have placed value on,
yeah,
and that can be a little bit discouraging, and then that can dissuade people from going down certain pathways. And it's obviously people want to make a good living financially, and physicians come out of medical school on average now, I think if the number's probably close to $200,000 in debt. And so there are some real financial implications to the decisions we make regarding what specialty we choose. But it's unfortunate that, as you're alluding to, it might be driving some of the frontline providers away from that position, or people not even going into that position
yeah,
because of circumstances that have been created.
yeah. Is there any kind of solution to that big idea there that you're aware of, or any even thought? Maybe there's somebody listening right now that's like, well, I want to look into this more, and maybe they're even feeling some conviction of like, I want to get involved in that. Are there? You've already shared a lot of great insight. Anything else on your mind there that is towards the end of solution, or even ideas or trailheads to clear to go like search further into it?
I wish I did.
Not that you know, that's fine.
I
Yeah,
wish I did. Yeah.
I think you've already shared a lot of good stuff, but I was just wanting to pick your brain if you had other insight. Yeah, yeah, it's really a refreshing conversation though, talking to you, Justin, and really good to hear your perspective. And again, I think most of us that are not in the healthcare world, yeah, we don't know what you guys are walking through and what you're facing, and hearing your motivation, hearing the pleasure that you have in your work and the joy in the work that you're doing. It's inspiring to me, and definitely gives me grace to be a better patient, you know? Like when I need care, I
Yeah.
walk into a place where I need care and just like, okay, these guys are awesome people and they're doing good work, and but they also got a lot they're navigating. So
Yeah.
yeah.
Yeah. Yeah, they do.
Well, appreciate your time. Anything else like parting thoughts or last bits of wisdom from Dr. Justin Sharp as we talk about being in the medical realm?
No, I'd say something that, as I thought about our interaction today, not knowing exactly what we're going to talk about,
Yeah,
people that have everyone has a faith in something, but as a Christian, it's been an interesting balance for me, because as I mentioned, that there's such a process of, I need to learn the tool of medicine to be able to succeed in the environment that's created here in our world in terms of the delivery of healthcare. You have to pass tests, you get evaluated by your peers and by your superiors constantly until you one day get to a point where you're able to independently practice. And then for me, I didn't incorporate things like prayer or being able to discern things about people that you're interacting with as an additional way to bring health and healing. And so as I've been introduced to more of those concepts and I've experienced the power of prayer on an individual level, there's this natural bent for us that are called to help people. How do we incorporate this into something that God has already given us? But sometimes those two can feel like they're opposite sides of your brain, where you're living in objectivity in a very rigid world that is Western medicine. But yet, how do I go into this more abstract realm of prayer for even physical improvement or healing or emotional healing in individuals? So that's been kind of an interesting process and journey for me of how to incorporate those two together. Sometimes it feels like I have to take one half of my brain out and just use the other and then put the other one back. But obviously the Lord is in all of it. He brings health and healing through each of those expressions, but really wanting to have, I've thought at times it would have been nice. And again, I don't know what kind of medical school this would be. It'd be a pretty cool medical school where you learn both of them together as you go through the process, as opposed to maybe trying to bring the other one in. But that's why, especially here and people that I've interacted with, but in this community, there's a troop of healthcare providers that are really trying to bring all that the Lord has available to us as an expression downstream. And I feel like that's only going to increase in the days ahead. So I think that's an encouraging last word, is that we have people that can not only bring great medical care with what we know in this time in history, but also bringing that spiritual component to it as well.
Yeah, that's great. I love that. That'd be an amazing medical school. It's like the synthesis.
I know.
It's like the togetherness. We're like a triune being, and why separate them out? That's good. Well, man, I definitely feel encouraged talking to you. Just grace for you as you're doing the work you're doing. Thank you for the work you're doing. Thanks for taking the time to share a bit of your journey with those that are connecting to this podcast, to our platform, Justice Collective. I definitely feel built up, and maybe there are some people out here that are like exposed this moment that are going to go become doctors just because they heard you talk, Justin. I don't know.
Wow, that's weighty, but I'm in the 40 club. I haven't hit 50 like you, but it is amazing to think. I don't feel like I'm 16 years or whatever it is from graduate from medical school, but yeah, it's pretty wild.
Well, no, it's obvious that your life is having an impact on many people. So keep up the good work. And I think another side of the impact of your life is your voice. So that I think this is good that your voice is getting out a little bit. I definitely can see the benefit that others will gain from being exposed to you as a person, man. You carry a lot of life. So thank you.
Thank you.
Thanks for the work you do in our NICU and with babies and families. I'm sure there's so many people that would love to personally thank you, but they probably do that in other ways. And yeah, it's been good having this conversation. Bless you. And thank you guys for those that are joining us. Again, we say get involved. The world is run by those who show up. So make sure you follow your passions and live out your dreams. God bless all of you. And I'm going to say goodbye.